Wouldn't it be great if we had an oral form of semaglutide that works? Let's talk about it. Hi and welcome back to my channel. My name is Dr. Meghan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And why is that important? Well, because I prescribe these medications all the time. I talk to patients about them all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So welcome. Today we're going to talk about an oral form of semaglutide. Does it exist and does it work? So the good news is there is an oral form of semaglutide and it is called RYBELSUS. Now RYBELSUS is only approved for type 2 diabetes currently. It is not approved for weight control. Now the dosing for RYBELSUS is different because it's an oral medication. It goes from 3 milligrams all the way up to 14 milligrams and it's taken daily. There isn't a lot of research on this with regards to how well it does for weight loss. Anecdotally, I've had some patients that have tried it for weight loss, but I would say in my personal experience, they haven't had great results and they've had a lot of side effects. But there was a really interesting study that came out last year in the Lancet that I think is important to look at because it's really pretty much the only study that we have with regards to oral semaglutide in patients with overweight or obesity and not diabetes. And there is more literature coming, so we will all be on the lookout for that. Yeah, so this Lancet study, it was 667 patients. It was a randomized, controlled, double-blind study, so patients didn't know what they were taking. The prescribing physicians did not know who had what. So it was a well-constructed study. And they were randomized to receive either placebo or oral semaglutide 50 milligrams a day. And that's important because that's way above where we normally prescribe RYBELSUS right now. The max dose currently is 14 milligrams, not 50. So that's quite a jump. They did this study over 68 weeks. And what they found was after 68 weeks, the patients who had been randomized to oral semaglutide, that 50 milligrams per day, they lost about 15.1% of their total body weight, which is amazing and also extremely close to the results of the step 1 trial where patients with overweight or obesity were randomized to receive injectable semaglutide at 2.4 milligrams. So it was pretty much identical results. So for this study, semaglutide, oral semaglutide, they lost 15.1%. Placebo, they lost 2.4% total body weight. For that step 1 trial with the injectable, the semaglutide lost 14.9% total body weight and placebo was 2.4. So, I mean, pretty much identical results, which is fascinating. However, in terms of side effects, 92% of the patients on oral semaglutide, on the RYBELSUS essentially, 92% of those patients had side effects, but 86% of the patients on placebo had side effects. Now, mild to moderate GI side effects were the most common, and about 80% of the patients on the RYBELSUS had that versus 46% with placebo. So that's a big gap. However, this is very, very similar to the results of the step 1 trial, where about 89% of the injectable patients on the injectable semaglutide had side effects, 86% of the placebo patients had side effects, and then 74% of the patients on the injectable semaglutide, 74% had GI side effects, and 47% on the placebo had GI side effects. So it's very, very, very similar. So overall, very interesting results, very similar to the step 1 trial results, but the dose is much higher. So time will tell whether this ever gets FDA approved for weight loss. I think it would be amazing if we had a really effective oral medication for patients. It would be a lot easier to dispense and distribute. That would be terrific. But clinically, you know, my experience has been limited, but not very hopeful. So I'm a little cautious in terms of, you know, what this will look like from a day-to-day perspective. But based on this one study, it actually doesn't look too different from the results we had with the injectable semaglutide. I know there is more research being done, so we will all be very interested in seeing that when it comes out. Thank you so much for watching. That's going to do it for today. Like, subscribe, do all the things if you want. I hope this was helpful. My references will be listed down below, and please be well.